Welcome to The Space Between. On this episode, I am joined by Dr. Marcellus Walker. Marcellus is a board-certified internal medicine physician who is trained in a vast array of modalities, including functional medicine. He blends Eastern and Western medicine to better serve his patients on how to live a life of ease and wellness. Together, we discuss individualized care, energetics, the doctor-patient connection, and the future of wellness. It's never been more important to have agency over our health and continue on the path to optimum health, no matter what we are challenged to overcome. Join us as we connect through conversation. Welcome to The Space Between. My name is Alyson Rixner, and I'm so excited to have the audience here with us for another episode of the Space Between podcast. Today, I am so excited to welcome a man that wears many hats. First and foremost, Christina Walker's husband, who has been on the podcast before. She's been on 3 episodes of The Space Between. But Dr. Marcellus Walker, welcome to The Space Between.
Thank you for inviting me.
Thank you for coming. I appreciate it so much.
Absolutely.
And today we're going to talk about something that is really important, health, right? But more specifically, functional medicine.
Mm-hmm. Yeah.
And it's been a hot buzzword. I would like to think that you were doing this before it was even coined functional medicine.
It's very true. Yeah.
Because I did my research. I came with some receipts today, and we'll talk about it. But yeah, it's an interesting time that we're living in. Yeah,
everything has its own timing, and I think that society kind of leads the request for healthcare, in particular, to evolve, and it's exciting to see that this expansion of our definition of healthcare is happening now. So it took a little while, but I think healthcare changes and in response to people's needs. So it's an exciting time now.
That's beautifully said.
Yeah, thanks.
And we're going to dive into it. And the time that we're in, I've coined the space between. It's just a saying, right? But ultimately, what it means is we're in some wild times, and things are very different, and a lot of things are crumbling.
Yeah.
Healthcare being one of them.
Yeah, absolutely. And I can't think of a better term, because it really gets the awareness that there is a betweenness, and something to be between means you have to have two of some sort, right? So in order for there to be a between, it means that there is maybe something else going on. And up until now, throughout most of our lives, we may not have needed to become aware of that, but sometimes there are people who are either pushed into that awareness or it's a naturally occurring awareness. Other people want to know about functional medicine maybe because they want to build muscle mass, or they want to look good in the gym, and that's perfectly okay. And that's a good utilization of those. I want more options. But then there are also other people who just don't feel like they fit, and they can't even put it into words as to why. And when they seek health care, they feel that something's missing. And so I think that you're doing a tremendous service to people by holding that intention so that people could kind of gravitate towards it and start to articulate what they're experiencing.
Thank you. I appreciate that. So that's so well stated. Again, it's going to be a great social media clip. I know now exactly when things are going to be great. But I appreciate your support, and just having someone like you. I will get into how we know each other and how many years we've known each other.
For sure.
Understand what I'm doing just means so much. So I'm so grateful for you. And thank you for being you and for being able to articulate. It's actually not easy to articulate the time that we're in and what's going on.
Yes.
It's very emotional.
Yes.
And it's hard to put, emotion, energy in motion. It's hard to put that into words.
Yeah, absolutely. And it is kind of totally feeling based, right? So, it is a big transition, it seems, a big transition step. And that's really stressful for people. I see people all the time. I'm here in New York, but that say, I have anxiety. And I say to them, it's not necessarily that you have it, but the city is anxious and you feel it. And
That's so nice of you to acknowledge that.
And so
finally.
So I think that we it is the change, the transition that we're going through on a global level is felt, and we have to how do we deal with that seismic shift? And I think it's so to be able to have a forum that people could be validated and could be aware that this is happening not only to them but to other people, and that they could feel some solace in that.
And the validation is such a beautiful thing, because I think in so many ways in the space between, most importantly, healthcare, right? If you don't have your health, you have nothing.
Yeah.
People feel very invalidated.
Yeah.
And they're made to feel as though, I have a friend that always says the weight of the world is on your shoulders.
Yep.
And the dis-ease, right? When we're not in ease, when the opposite of ease, dis-ease, that comes about when that's the way you operate every day.
Yeah.
Right? Feeling pulled down and just all of the things that are going on around us.
And when you don't have a vocabulary for it, where you can't really articulate it, and even the fact that you feel a bit isolated and that there are others who don't get it. But once you start realizing that there is a larger community of other people out there who may feel the same as you, and that you can start to speak to it, it already starts to decompress you and makes you feel like, I'm not that much of an outsider, and that really it may be the changing norm. But we have to give it verbiage. We have to speak to it. We have to find those friends that we can talk about it with, who will already start decompressing us and helping us stabilize and get through it.
Yeah. And you've been one of those people for me. And I think you'd say vice versa. We've had some really interesting conversations lately.
Absolutely.
Those are for private moments.
Those are great.
Maybe someday we'll bring it on the podcast.
Yeah, absolutely.
So why don't you tell us a little bit about yourself? You've had a lot of lives within the healthcare space. So tell us a little bit about your background.
Well, thanks. So when I was a kid, I probably was 6 or so and living in Michigan at the time. And I was like, people were saying, you should be a lawyer, you should be this and that. But there was a moment where it just came to me that, I should be a doctor, right? I want to help people. And I was lucky in that way, where once I kind of locked in on something, there was no change in my mind. My dad was a teacher. He taught physics and chemistry to high school kids. In fact, he asked the class what they should name me when he was a teacher, and they said Marcellus. So they came up with my name.
No, I did not know that. Wow. Okay.
So we grew up.
You have a lot of love and energy behind your name, all those people naming you.
Yeah,
that's
absolutely.
Awesome.
So I grew up in this kind of scientific background, so it felt like it was pretty normal. But all along the way, I always felt a little bit like there's bigger answers out there. So I was always that searching, wandering kind of guy who was looking for more answers to problems, or to problems that people were having. Yeah. Not. I think that's more accurate. And I was fortunate to get through high school and then college, and then I got accepted into medical school in Chicago, and I remember myself and my roommate, who's a long-term friend of mine and still a friend who lives in L.A., we had one poster of reflexology and another one on Chinese herbs on our wall, because we were into all of these ideas and stuff. And so to us, it was really not a foreign concept to learn about conventional medicine, but also to learn about these other things that were out there.
Right.
And so after graduating from University of Illinois in Chicago, and then I did my residency at Duke in North Carolina, I was always like the slightly weird one who would come up with ideas of that Eskimos bleed their blood is 3 times thinner than others because of fish oils. So it was always that guy, so people kind of ribbed me and stuff. But then after residency, left and moved to Honesdale, and there I was able to really take my days off and learn about alternative or integrated medicine approaches. And my friend George and I, we went and took acupuncture training and all that, and then came into the city and did some Chinese herbal medicine training with a wonderful person named Jeffrey Ewan. Some of the people out there may know, and just kept building on that because people would come to me and they would talk about things, and I had no clue what was wrong. So I was like, either it's me or it's you, and it's probably me. So I got to keep looking. So
wow, that is the most humbling and amazing thing I've ever heard a doctor say.
Yeah, I mean,
wow, that's awesome.
Yeah, and people can all relate to the fact that in medicine, we get a certain kind of training, and then when people come to us, there's a limit to where we can speak to. And frequently we're kind of searching for cues that would say, oh, it's probably this or probably that diagnosis.
Right.
Even though once we have a diagnosis, what are we going to do about it may also still be limited.
Right.
So it's kind of, for all essentially practitioners, I would imagine there's some level of uncomfortability because we realize that the scope of things are bigger than our training and our what we know.
Right.
So there's always that gap, and for me, I was fortunate enough to listen, and then keep searching, and so
and be curious,
right? Yeah, and so. That's
and to not have a God complex and say, I know everything, which is also amazing.
Yeah.
A lot of people have that. And
I mean,
there's a humbleness to you, which is really beautiful with all that you know and how many things you've experienced. It's almost like you know that there's more.
Yeah. And we're faced with reality that tells us that there is, right? So either in, we don't listen, which is part of being a human being, is that we tend not to listen. To varying degrees, or we say, okay, let me go look for other stuff. And I had kind of developed a little bit of some success at hunting for things, looking for stuff. And so it was kind of a natural part of my makeup to keep looking and doing those kind of things. So, and then I also experienced a lot of really amazing things that if you continue to pursue something. And one thing I felt was important to say to the audience today was that a lot of times you'll be faced with situations where you're not getting answers, and that we're always kind of trained to go outside and look outside of ourselves for those answers, but that if you persist with it, that maintain hope, that indeed you can potentially find an answer for that. And so I had some experience with that. I had some positive reinforcement that said, hey, if you stick to it, that you can actually, there's another side to it, right? That you could actually get to the other side. Yeah.
All we know is that nothing ever stays the same, right?
Yes.
And it continues to be organic and materializes. That's beautiful.
It changed.
That sounds like your North Star.
Yes. Just stick to it.
That's amazing.
Yeah. So along that line, there were a lot of natural evolutions and expansions. I did training in functional medicine, which at the time was really a German-based modality, meaning that the approaches came primarily from Germany with some of the BICOM and other devices that would look at figuring out what is going on with your energetic system or electrical system, if you will, or however you may want to word it. But and all of these approaches, I also trained with someone who did what's called metabolic typing, which was which is really a wonderful modality of looking at you as how to individualize therapy for you. So it was one of those early approaches at individualization or personalized medicine. And it's great to see how that is really expanding now. And people are really looking for that. And we're constantly trying to find the right way to implement that. But in those early years, it was kind of a natural thing. And I'm really happy now to see that's growing up.
Yeah, you were so ahead of your time. I mean, you and I met. So Honesdale is a town that's very close to where I grew up.
Yeah.
And I don't know how my mom ended up finding you. God only knows. I'm sure she won't remember. She doesn't forget anything. But I went to you as a child. I think I was maybe 12. Yeah. And she said, we're going to go to this new doctor, and it's Dr. Walker. He does things differently, and I like the way he thinks. And my parents were kind of visionary, and little old Honesdale, like the things that were happening there at the time were really kind of badass and cool, right? Again, so ahead of their small town.
Yeah.
A lot of that, maybe it was happening, maybe it wasn't, but it wouldn't have been what people thought.
Yeah, and it already had a root in that they were like the Himalayan Institute was there, right?
Right, yeah.
And so it was always kind of a funky little town, if you will, of alternative thinkers. For the most part, it was close enough to the city, right, yet also far enough away. But it was. And that was the other thing I learned, that a lot of times things that are transformative can happen in little places, right? Mm-hmm. So
I love that.
Yeah. I mean, and I think about the audience or people who may be listening to realize that they too can make a shift in some way, right? That who knows why they may be going through whatever they're going through, right, but to stick with it and to not doubt yourself and to continuously listen to yourself is critical, right? And so
I knew you were going to bring that up. It's an inside job in a lot of ways,
too.
Too.
Totally inside. And as in society, we're always kind of externally focused, but the in-between is really about how can I start to listen to myself and the dialogue within myself, and then to both figure out what it is I'm experiencing, and also maybe how to navigate to find solutions. So
get to the other side.
To get to the other side.
Whatever the other side is.
Whatever
right?
That is, yeah.
Of the day or the week.
Over
or the
the bridge,
right?
over the hump.
Exactly.
So, yeah.
Well, it's interesting because you brought up something that I was going to ask you. So we always read a definition here, and functional medicine, integrative medicine. I want to know what you think in a moment.
Yes.
But the Institute for Functional Medicine definition is a systems biology-based approach that focuses on identifying and addressing the root cause of disease. Each symptom or differential diagnosis may be one of many contributing to an individual's illness or disease.
Yeah. And it's a really great concept in that it's really an expansion of what we have learned conventionally to date.
Right.
And it's almost like still considered separate, but there's an attempt to try to integrate that. And if you look at some of the centers like Cleveland Clinic and other places with Mark Hyman, and his work, and a lot of people are really trying to bring these pieces together. One of the things I realized, though, that a lot of innovation has to come from the outside. That right. Once you've developed it, you brought it in, then people can partner with you. But it's hard for a lot of institutional structures to really make that pivot. But they can partner with something that comes from right. the outside. And I think that we'll see more and more of that over time. But the terms have really kind of shifted from holistic to alternative to integrative, and now more functional. And I also like their focus, which is that they're really kind of focusing on the physical aspect of ourselves. Right. They do bring in some energetic concepts, but it leaves it hopeful to people as a place that they can get some additional answers. And I think that still we have a bit to go to better understand the full anatomy on the physical level, as well as what this other side thing is. and how that plays into health and wellness and all of that. So, but yeah, functional medicine, I think, is the roots of it. The term came mainly from Europe, Germany, from places like that, where they were working with a lot of these modalities. Something called neurotherapy. There's so many different modalities that came from that place, and I was fortunate enough to learn a lot of that and train with a guy named Dietrich Klinghardt. And Dietrich trained over there, and then he brought some of that to the United States.
Wow.
He is a MD, PhD guy who's was from mainly out of Seattle way, but bringing some interesting modalities. So we had some good times together, and so I think it's a positive thing, and I think it's exciting to see how it can further integrate into conventional care.
Yeah, absolutely.
Yeah.
What a story. And to think of, I always think of any entity that has its own energetic footprint, and this whole evolution of medicine to where it stands today and where it's headed. It is kind of its own organic thing. And there's so many people and so much different energy that's put into it. A lot of times I think, if you look from the patient side, right, it's kind of like, oh, well, that's over there and I'm over here and I'm not really part of it. And they're telling me what to do, whether I like it or not. And I think I would charge the audience today to begin to shift in your thinking. Because if that is how you feel, no shade, you do not have the right practitioner. Right? I'm not calling it like whatever, it is what it is, but you shouldn't feel disempowered.
Yeah.
You shouldn't feel confused. You shouldn't feel scared or uneducated. Like you said before, which was so beautiful, go inside and find for yourself what you feel. And you'll know when you've met the right person that can help in conjunction.
Yep.
To bring you to wellness, because it doesn't matter. You could have the best interventions and you could have the best plan. What happens at home and what the choices that you make every day and the things that you decide to do or not do is a really big part of the care.
Yep.
It's probably 80%, right?
Yep.
Because what more are you supposed to do? You're not there all day with that person.
Yep.
And it's a relationship. And people are really struggling with relationships right now. There's these power dynamics and things are crumbling, right? And the patient-doctor relationship is a really interesting kind of like spotlight of that, if that makes sense.
No, it makes total sense. And I think from a doctor's perspective, we can probably do a better job of making peace with the limit of what we can offer. A lot of times we have compassion for people. I think that most docs do. And we want to, because we're really fairly motivated individuals, we want to try to come up with an answer. But if we don't have the answer, I think the one place that we have to change our terminology is to then somehow flip it to say, well, it could, to have a person walk away slightly feeling as if they have done either something wrong or that it's psychological or that it is a deficiency on their part.
Right.
So I think that medicine we have to do a better job of accepting this is my training, these are my tools. I wish you really well in that, and come back and see me and let me know how it goes. Right. But based on what I have here, this is how much I can contribute. Right. And therefore, I really wish you well. Keep searching, keep going, keep looking for answers. And unfortunately, what we tend to do is to blame the person in some way. And so what I see a lot is people say, come in and they'll say, I know I'm a hypochondriac, but
it's an interesting way to start out a conversation.
Yeah, they do it because it's almost like they want to give. They realize that they set it up so that the.
Well, first of all, it sounds like shame.
Yeah, they're a bit ashamed to bring up an idea of what they experience, right?
Right.
And that they
probably because they've been told something before, right? It's
Yes.
also like the trauma. It's like getting into a new relationship with somebody that got like really screwed over. The last 3 like really fucked me up. You know, here we are now, like, hey.
Yeah, exactly.
And that's part of it too, especially if somebody's not well.
Yeah,
Think about how many people and energies have come along that line, right? In their quest for health.
And they already know that, probably from Googling, et cetera, which I always encourage people to do, in the sense that I always say to people, I was like, well, whatever you found is probably not as bad. Whatever you came across is probably worse than what I'm going to tell you. So it's great.
That's the low bar. Like, that's the dumpster. Go have fun over there.
And then a lot of people said, I'm going to refrain from doing that. So I thought I'd come in and get a curbside consult. So, but it is a little bit of embarrassment to talk about what it is you're experiencing, because healthcare may not have the answer. And I think what I would say to people is, realize that person may not have the full answers, and that's okay, because their training is very specific. And if there is a space between, which we all know that there is, our language proves that, and we can get into proof in what we say, but that therefore their training, no one has training for that may encompass everything you feel and you experience, and therefore it's okay. They'll contribute to the degree, they'll rule stuff out, and then but it's a journey a lot of times, to continue to keep going until you find a solution.
Right. So what you just said brought up an interesting question. I love these conversations because it goes exactly where it needs to go. So there's something to be said for, and this puts people in your position, right? Physicians and the like, in a really uncomfortable situation, because there's this narrative, and we talk a lot about narratives on the podcast, like what exists in the collective, what are the things that we just organically believe without even really thinking about what it means to us or our path, right? Well, the doctor knows best. There's this almost like glorification that has existed. Talk to me about what that does to you.
Yeah.
Because we always think about it from us. It's like, oh, I better listen. So if I don't listen, I'm going to be sick. And you should listen to someone when they know better than you. But as we move into this new age of Aquarius and this Piscean age, it's very different with, it's an inside job. It's not an external.
Yes.
We're not looking to everything. Yeah. How would you respond to that fact when people like, oh, it's the guy in the white coat? Like, ooh.
Yeah, no, I think it's both the provider and also the person seeking care's responsibility to have mutual respect for each other. I see a lot of times people coming in already kind of guarded and sometimes almost a chip on their shoulder, which is kind of hard to navigate. And it's understandable. It happens. It's not it does happen. People are in pain, or they've been through so many bad situations that they're already like, now I have to tell someone else
it could
my
be their
story.
10th go around.
Yeah,
Who knows
absolutely. And they're scared, they're desperate, there are lots of things. So I get that. And I think if we could reach a place where both people are realizing that, let me contribute what I have today, and even that there may be a need to come back to see you over time to really get a clear picture of what's going on. Or you may try something and then later come back and see, did that make a difference? And so I think that as long as you're not pressured for time, there are certain conditions where you're absolutely pressured for time.
That's a whole other podcast that we should go to, the structure of conventional medicine.
Yeah. But I think in a couple of things that are helpful for you. One, make a list, because it's always pressure when you're sitting down trying to remember everything. It's like once you get in the chair, your mind goes away.
Yeah, totally.
What goes away? But sometimes it's stressful for you to just sit in the chair. So I always say, make a list of everything you experience, and handing the list or providing the provider with that list is also helpful for them. Because they can scan it frequently and also listen to you and kind of get the big picture overview. and be helpful where they can contribute. So, and also if you go from one place to another, keep copies of every document that you have.
Nothing
right?
talks. Newsflash. Nothing talks to each other.
Yeah.
You have to be your own document management source these days, which seems crazy, but it just is what it is.
Yeah, you absolutely do. So I'm still old school. If you can put it in a file folder, it's easy to flip through. Yeah, my chart works too as well. But I think what it does is it maximizes that visit and allows the provider to be mostly more helpful. And then after the visit, realize that they may not be able to fill in all the holes or fill in all the blanks, but they may also have something that they can contribute to help you along the way. So I think that is it's frequently a journey. Like sometimes you'll have to search and find the full solutions for yourself. But trust that you can do it. Trust that there's a part of you that can steer and navigate and actually find. I see people every day, they just pop in and it's like, well, I always say to them, well, you found me for a reason, so let's have that discussion.
Right.
You know what I mean? So
there is a lot of trust that has to exist in this time, and especially with health.
Yeah.
Yeah. That's a great answer, because it is. What I love the most about you as a doctor is that you don't see those lines that are drawn by society, right? It is a reciprocal relationship. It's a partnership. In order to get anything done in this world, it has to be a two-way street when there's multiple people involved. Yeah.
And you're a unique individual, And the one thing I did want to add that 1 out of 10 people that are born has a unique genetic variant, which means that there are significant things that you as an individual are probably dealing with that may not be like you see someone that has kind of recurrent pulmonary problem, lung problems, sinus problems, et cetera. There may be a reason why that chronic stuff, right? Yeah. So that the only way to it is to get a personalized insight into you as an individual, and that's coming, but as it blossoms, it'll be more helpful. So just hang in there.
So that's another wild frontier, and I think with AI and all the other technical modalities, it combined with humans, people are like, oh, AI. You still need humans to figure it out. So
yeah. The art of it is when we listen to each other and we communicate in a lot of different ways. So sometimes someone is talking, you're talking with the doc, or back and forth, and impressions come, and you get some insights and awarenesses. So. Yeah. So
the small things that you were talking about that before.
Yeah.
Right? They end up being bigger things.
Yeah, absolutely.
That we don't realize. There's a lot of uncovering you can do in the small, or what we deem small.
Yeah,
right?
Yeah,
with
absolutely.
Our perception in small little 10% of our pea brain that we use.
No, it's I think we you talk about collective too there, and. A lot of times I keep going back to trying to sort out what you're experiencing, and whether or not some of that is really just from this going on as part of the collective too. So
that's what I'm going to have you back to talk about, the collective unconscious.
Okay.
Oh my God. That'll be a 3-hour podcast.
Yeah,
imagine?
Yeah.
We'll need like a week's vacation after talking about that.
Yeah. So.
No, that's great. I think, it's so funny because we hit basically all the points that I wrote down. I'm looking at my outline. I think one of the things that I'd like to talk to you about is our emotions and how that impacts the body. I am actually tomorrow, so we're recording this in May of 2024. Tomorrow I have a somatic psychologist on the podcast.
Wow.
She's very interesting, based out of New York, Dr. Talia Shafir. And it's all about the body, right? She is learning and teaching people how to manage what is stored and on the path to wellness, right? And on the path to feeling better. So I think, so much of what we believe to be wrong with us is here and here. And one thing that she said that was so classic, she was like, your head is part of your body. And I was like, people need to be reminded. I needed to be reminded of that because we think of them as so separate, right?
Yeah.
And we have so much anxiety and there's a lot of depression. There's just a lot that people are going through mentally. But I think with holistic or functional or integrative medicine, again, it's all part of the whole. Nothing is separate, right?
Yeah. And I think the slippery part is really our terms in the sense that we physically have a physical brain, we have a physical body, right?
Yep.
But then, in our language, we talk about things like, I just feel beside myself, or I had an out-of-the-body experience.
Yeah.
So any of those terms are really suggesting that there is something else, whatever that is. If you want to call it mind-body, it's not the physical mind. It's a different kind of mind. But it's a part of who you are. And I think that, we each are going to have different terms for it. And as long as we start to think about that, maybe not that everything is psychological, but that we can feel and we have experiences, and those experiences may be part of a relationship. And I waffle talking about it because it's for people who are having this kind of duality kind of experience.
That's the word that was coming to me.
Yeah.
It's that duality.
This is, and some people are like, I don't know what these guys are talking about. And that's okay because it's not, we each have different things we're going through in different phases. But there are people who definitely are having this kind of confusion about where am I hearing that from? What's going on? Like I have
the other
these
realm, the other
these
side.
I just switch and I flip,
other dimensions. It's what we can't see. I call it what we can't see with our senses, our third dimensional senses.
Right. Yeah,
it's what exists. Some people call it the ether.
Yeah,
right? There's so many different words. Some people call it God.
God, soul, energy, body, whatever term. Think about it as there is a relationship there.
Yes,
and that within that relationship that you can have a conversation and but the key is, how do I translate what I'm hearing? I, as the physical one, can translate what I'm hearing and experiencing and made aware of in a way that I got it. Right. Because sometimes I may be hearing green and I would translate it as a different word, red. Right. And so part of it is to just be aware that there's some thing that like images or when we're thinking,
there's like clairaudience, clairsentient. And everybody has it.
Yeah.
Right? I've talked about this many times. Talked about it with your wife at length when we did the energy episode.
Yeah.
This is a real thing. I think at this point, most people listen to this podcast.
There, right?
And if they're not, they're well on their way. Come on in. The grass is greener on this side. We could tell you, because it's just like tuning into a different frequency. It's interesting. What you're saying is bringing up a story. So when I had moved to New York, I've been here for about 14 years, and someone very close to me was going through a pretty serious depression. It was very difficult for me. Mm-hmm. And I ended up calling your wife.
Okay.
And I said, Christina, I'm a total freaking wreck. Like, I can't sleep. I'm anxious. And, Christina's always like, whatever you need, I'm here for you.
Yeah.
And I would literally go see her when she was over at the operating room, when she was running the operating room over on 14th Street.
Okay. Yeah.
Like, she had time for me. She's got scrubs on. She's like, come on over. This is the way these folks are. They're amazing. And she gave me the book, The Marriage Between the Physical Body and the Energy Body by Christine Schenk, who you guys both studied with.
Yes, exactly.
And in that small little office of the side of that operating room, she taught me for the first time in my life how to bring my energy body into my
your
physical body.
Yes.
And I'll never forget, there's these points in your life where things happen to you.
Yes.
You forget, especially me, you forget a lot of things. I will never forget that as long as I live. And that was such a big part of my journey too. And I think, if you're having feelings of anxiety or dis-ease and you've checked all the checks on the physical side, right? There's nothing wrong with you. And you're sitting there going, well, bullshit. There's something really wrong with me. I can't sleep. I had migraines. I felt like I was plugged into a socket and I couldn't, and it was hard to even explain what I was feeling or what I was going through. And of course, Christina knew me, so she got it. And that really set me off on a different path. And I think what's important is for people to know that you're not alone in feeling like, oh God, what is going on with me? There are so many factors. And I think that's what Marcellus is really trying to say, right? With,
absolutely.
With everything that you've talked about today is like,
as
there's so many options. Just keep going.
Yeah, exactly. And as a doc, I'm trying to stay on the physical side for the most part, but I want to encourage people that some of what you experience is part of that dialogue inside of you, but some on this other element, sometimes you pick up awarenesses outside of you. And so you start to just ask yourself, is this me or is this something I'm picking up or I'm becoming aware of outside of me? So it's a little bit on the other side in terms of discussion, but we make it a distinction in our current culture, whereas in a lot of the older cultures, this is normal. So in reality,
what we would consider ancient medicine, which is so funny. That term is so like, what is
ancient.
Time anyway? Let's not go there. That's for another dinner conversation.
So our elder brothers, if you will, and our elder groups, it's our society has just kind of not created the space in order to have these conversations comfortably, and have in the past viewed them as not normal in some way. So
it was a narrative I wrote down.
So
it's witchcraft, or if you're not following conventional medicine, these modalities are, you're crazy for thinking that this matters. And why is that? Who says who? Well, medicine, I always like to say that medicine, the science is the physical body part, but the art is something that we talk about, but it is actually this. We used to have, when we couldn't figure someone out and like they were in the ICU down at Duke or whatever, we would always call this particular attending, and he'd walk in, he'd stand by the bedside, he'd talk, he'd listen to the case and say, work her up for this. Now, where is he getting that from? Right.
So part of what happens when you work and talk with someone is that they can be sometimes helpful to be just a bookmark for you, to give you some feedback. But there is medicine is an art too, and that there is this communication that takes place that helps us get insight in terms of order the CT or whatever.
Which could be physical or otherworldly.
Yes, right.
I mean, there's an intuition, right?
Yeah,
and maybe that's a whole other episode that I want to do. But it's very strong. And the more that you trust yourself, the more that you trust the people that you're in a relationship with, physicians or of the like, or even people in your life, that's when you can really begin to let like this mental block down, right? And let that guard down and just kind of be open to what might come. And it's really hard when you're sick and you're not well.
No,
I'm not sitting here being like, oh yeah, just be open and be friends with your doctor. I'm not saying that, because it's a journey. But if you can find just a little bit of trust and faith and curiosity to keep going, you will feel better.
And it's also just stay with it, because but as we're alluding to, how you can start to have a dialogue within yourself is kind of it's a different way of thinking about things, or it's a different way of proceeding. But sometimes just listen, ask yourself, hey, what's going on with me? Or just make it normal. Normalize it. People say, oh, you talking to yourself? You're crazy. But no, it's like that's
the only
healthy.
difference between us and the people that are down on the street doing that is we're doing it in our head and not speaking out loud, and they're just speaking it out loud.
Yeah, right, exactly.
I remember there's one day I just saw this guy and I'm like, there is no damn difference. That actually, he's more open and being honest with who he is than I am over here like hiding my crazy shit. And he's out there going, blah, 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 blah. And I'm like, what he's saying is actually really interesting. I stood there and like listened to it for 5 minutes. I'm like, wow, he's playing Mensa, or he knows what happens with people. But very good point. So our time is almost up. It goes so fast, doesn't it? Which makes me sad. But we'll have you back for sure.
Absolutely.
So as far as I always like to end all of these episodes with not like wax optimism, right? I'm not looking for like some happy-go-lucky bullshit here. Right. What do you hope the future of, and we're using functional medicine, but the expansion, let's call it the expansion of medicine. Where does that lead?
So I think it really leads to the hopefully the awareness that there is, well, there's, I think most medical docs realize that there's a bigger reality than what they've been trained in, and healthcare, for the most part, its job is really at this point to focus on the physical aspect of it and get continuously better at that, and expand into genetics, multi-omics, genetic, looking at what's going on under the hood. There are levels of blood testing and things that can be done to get much more precise at understanding what's going on individually. There are so many factors that we deal with in the United States that are part of industrializing our food, et cetera. So we could talk so much about those things. So many of the things that are happening to us as individuals is not a fault of what you are doing wrong. It's really more of understanding what your unique needs are and what adjustments you can make. So I would say that medicine changes based on the request of society, and society is going to lead the change, and then healthcare will follow. Society gives permission for healthcare to change, and so I would these kind of conversations are the change-making moments. Absolutely. Where people can speak on something that would otherwise in the 1600s would be considered really woo-woo and could lead to death. And
we'd be slaughtered at the stake.
So and that we can start to have ongoing conversations that normalize what we experience, and that because you have these experiences does not means that you're just normal. Right. It's not that you're broken or crazy, or that you may not be able to have conversations with everybody. So you find people that you can kind of, we could talk. But then in other friends, hey, how about those Yankees or whatever? You know what I mean?
Compartmentalize with you, especially in the space between.
So it's okay. You can have both kinds of friends. So I would seek out some friends. And
not everybody has to agree with you on everything. We talk about that all the time on the podcast.
And you're okay, just keep staying with it, trust yourself, believe in yourself, and get back up.
What's a beautiful message.
Thanks.
And what a beautiful way to end. Thank you so much. Thank you for who you are, for your light, for all the love that you've given out into the world, and all your expertise, and all of the time you've put into your path, and I don't want to say schooling, I guess in ways it could be, but it's so much bigger than that.
Well, I'm really grateful for those people who were there when I needed them, and so I think this is part of and who taught me, or who made sacrifices for me for my own personal growth, and so I wish the same for everyone out there.
That's beautiful.
Thanks.
Thank you so much. Well, thanks to the audience for joining us today on The Space Between. We are looking forward to seeing you all soon on another episode.
Thank you so much for joining us in The Space Between. We hope this conversation sparked connection for you. Please like, subscribe, and share this episode with someone who will find value. And make sure to tune into our next episode as we continue the journey into the core themes of our lives. We'll see you again in The Space Between.